guys, and welcome to The Diagnosis. Today I have with me Riley, Brittany, and Mark, and we'll be talking about epidermolysis bullosa. What is epidermolysis bullosa, you say? It is a severe blistering disease that is inherited in an autosomal dominant fashion. And it usually shows up in infancy and early childhood. It is not contagious because it is inherited. These blisters may appear for various reasons. These reasons could be minor injury, some heat, friction from rubbing, scratching, or even just adhesive tape. Severe forms, these blisters be within the mouth and the intestines, causing just serious complications within, and can be fatal. Most children don't make it to be 30 years old. Sadly, there is no cure. Children with this disease, though, are often called butterfly children because their skin is as delicate as butterfly wings. Some of these symptoms are fluid-filled blisters on the skin, especially on the hands and feet due to friction, deformity or loss of fingernails and toenails. Like I said, internal blistering and like the esophagus and the airways and your vocal cords. This could cause dysphagia later on. There could be scalp blistering or scarring causing alopecia, and there could be like tiny white bumps on your skin, or even just like thin appearing skin. There's also causes dental problems and even some tooth decay. Would you like to tell us some about modes of inheritance?
I can. The genes that this disease works through are the KRT5 and KRT14 genes. These genes provide the instructions for the proteins keratin5 and keratin14, and what these proteins do is then make the skin, the epidermis, very resilient and able to withstand friction in everyday life. Mutations in these specific genes result in the keratin5 and keratin14 failing to form strong networks in the skin, and this makes the cells in the epidermis very fragile and easily damaged. So the skin is no longer resistant to minor friction and is susceptible to minor damage and the blistering, like you said before. The main pattern of inheritance for this disease is autosomal dominant. One copy of the altered gene is required for the disease to be expressed. Can be inherited from just one parent. But there have been cases where someone has the disease and there's no family history of the disease at all in that individual.
So you're saying that new mutations could occur?
They very likely can occur. In rare cases shown, there's an autosomal recessive pattern of inheritance, and what this means is there must be two copies of the altered gene in order for the disease to express itself, and parents most often will only have one copy of the altered gene and do not express the disorder themselves.
Thank you, Mark. Would you like to talk to us about some treatments and solutions, Brittany?
I would love to. So as you stated before, there is no real treatment for this disease. So our goal is to prevent the complications and ease the pain a little bit. By doing this, we can use medications that help with pain and itching of the blisters, and it addresses the complications that could come in the bloodstream. With doing this, we need to use a lot of doctors, including primary care physicians, physical therapists, occupational therapists, nutritionists, dermatologists, eye doctors, dentists, and psychologists.
Wow, that's a lot of doctors.
Yes, it is. So one thing that the doctors can do is surgery.
What could these surgeries help with?
They help with the blisters by doing skin grafts. It also can help with the normal motion by doing restoring their mobility. It can help the patient eat by widening the esophagus. It can also help the patient gain weight by placing a feed tube. Other ways to help ease the pain a little bit is by using a physical therapist or an occupational therapist to help with their daily activities and motion. Other research that is being done to investigate these treatments are studies to improve with bone marrow transplant, protein replacement therapies, cell-based therapies, and gene therapy. Also, patients are very susceptible to infections. This is caused by the decrease in lymphocyte production, causing the patient to have a lower resistance to infections. All right, patients should be careful because of their non-healing areas such as eye lesions. This can be treated by antibiotic ointment.
Thank you, Brittany. Riley, would you like to tell us some of the relevance of this horrible genetic disorder?
I would love to. So in 1886, this disease was actually first described by Koepner. And in humans, it affects about 1 in 17,000 births here worldwide. In the U.S., it's thought to be anywhere between 25,000 and 50,000 people here in the U.S. have this disease currently. And it's seen in about 20 newborns per every 100 or 1 million live births per year.
Are there any effects in animals?
There are. This disease was actually described in veterinary medicine in 1974, and it was suggested for very similar diseases such as red foot disease in sheep, hereditary mechanobulosis disease in horses and cattle, and then also an epithelial genesis imperfecta in horses. The effect isn't really known in animals, but in a Brazilian semi-arid region, there was a test done where 1 in 861 goats was diagnosed with this disease on a postmortem examination between 1983 and 2012. And during that same time period, it was found to have 1,144 cattle were found with that disease in that same time frame. So it's a very rare disease to get in both animals and humans, and unfortunately we can't just breed outside of the genetics to not get it since it's not seen very commonly.
Well, thank you guys, and thank you for joining us on this episode of The Diagnosis.